All right. Good evening, everyone. Can you hear me? Yeah. Can you hear me? Sorry, I didn't realize I'm on mute. I can see how many. There you go. Hi, Easter. Good evening. Good evening, everyone. Welcome to my another live stream. Okay. As you can see, we have some um background colors. Okay, we are improving. Okay, one day we have like a nicer camera. There you go. Good evening, everyone. So you can hear me. I can see how many we have. 1,000 viewers. There you go. 1,000 viewers this evening. So probably some of you might be watching this in the coming days. But thank you for joining us, and please to subscribe to my channel. Yeah. Can you hear the background music? I don't know if you can hear the background music. Is it too loud? Let me just let's sort the background music. I hope it's not too loud, yeah? Alright. Alright. There you go. Good evening, everyone. So thank you for joining us. It's not too loud, yeah. So no, there you go. So probably before we start, if possible, you can put in the chat box which country you're from. So let's see, or which part of England you're from. So let's see, or the UK. Let's see where you're currently watching at this very moment in a um, cold, not too cold Wednesday, Thursday, Wednesday. There you go. If you can comment on the chat box which country you're from or which part of the UK you're from. Let's see. Okay. Let's see. Oh, let's see your answers. There you go. I'm from Watford, UK. I haven't been to Watford. Okay. Yes, Easter's from Devon. Easter, I hope you enjoyed our final coaching last weekend. Yeah. There you go. I know. Easter. Um, Fatumata. I'm sorry. I'm really bad with saying your name. So you're from London. There you go. I'm also from London. Rosel from Liverpool. There you go. We have Sufiano from Northern Ireland. There you go. Um, yeah, comment to oh, Shrestha, are you from Reading? I was from Reading before. There you go. I hope you've seen my vlog when I left Reading. Um, Reading is still home for me. But yeah, I miss Reading. KSA. Oh my God. What time is it there now, May? Someone watching us from Kingdom of Saudi Arabia. There you go. Anyone from the Middle East watching this evening? Well, how many do we have? We have 1 million viewers now. There you go. We will we'll start shortly. I will just wait for more people to join us. You've seen my video, Shrestha. There you go. It's currently 10 o'clock in the Middle East. So you're 2 hours advance in compared to UK. Hold on. Shrestha, you watch my video. There you go. I was from Reading. I don't know if you're working in RBH in Royal Barks. There you go. I don't know how about the rest. If you comment which part of the world you're from. Okay. All right. So before we start, again, if you're new to my channel, sorry, my hair is really long now. I need to put a headband. So if you're new to my channel, welcome. My name is Emmer, and we'll be having a study with me session tonight. Yeah. So we normally do it regularly every Wednesday or Thursday. And today our topic is about common medications about the OSCE. So please subscribe to my channel, and please hit the notification below, the bell below, because sometimes I don't normally announce if we're going live, but now Definitely, I will try and announce it. And yeah, it's every Wednesday. So you will get notified, yeah, if we're going live. And of course, do follow me in my other social media accounts across social media. It's on the screen. Why not? And what else? My Facebook page. There you go. And cover couple of advertisement before we really start. Okay, so on the screen you can see, there you go. Final coaching, another next week. Yeah. So for those people who joined us, for those people who joined us last weekend with the final coaching, of course they can join us again next 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 week. Okay. So again, the link is on the chat box, I think. And of course, if you want to buy our workbook, why not? So said, you saw my video for the first time. Okay, so thank you for joining us, Son. Okay, please do share this live and of course ask your friends to join me study. Normally when we do live, we're just chatting. I don't have a presentation. We will just chat on a Wednesday evening. So you can have your dinner or when you're tired, just listen to me. Hopefully we can upgrade our microphone. Yeah, it's due for an upgrade now. Neelam is from Romford. I've never been to Romford. Oh, Shasta, your husband works in Evergreen. I know Evergreen. It's our neighboring wards before. Just if you can put in your chat box, which part of the country you're from or which part of the world. I know we have um, what do you call this? We have a lot of people from different parts of the world. Of course, please do if you want to purchase our workbook. It's there. It's on the chat box. And one more before we really start. If you want to become a channel member, I think it because I think I receive a lot of emails about that. If you go to my channel, there will be a link on how to become a channel member. Okay. Francis Francisca. I remember Francisca. I can't remember if Francisca was part of Francisca. I remember you're part of our final coaching last time, or I'm just making it up. Um. All right. Good evening. Good evening. So again, if you're new to my channel, please do follow me, subscribe, and share this live. Ask your friends to come over. So probably we have like an hour and a half to discuss about the common medication about the OSCE. So who's taking OSCE this week or who's taking OSCE next week? Probably some of you will be taking OSCE very soon. Raise your hand who's taking their OSCE soon. Good luck, yeah? So for those people who will be taking the OSCE in the coming days or next week or next month, I wish you all the best. And of course, we will do live regularly so you can we can study together. All right. So we will make a start. 2nd of November. There you go, Shasta. Good luck, yeah. You'll be fine. You got this. Okay. All right. So 10th, Victoria, 10th of October. What's today? Today is the 4th of October. All right. We're counting the days. I hope you're not that nervous. Um, just remember what's our motto for AIM? What's our motto? There's a motto there. Short, sharp, huff. Yeah? If you're nervous, short, sharp, huff. That's your intervention. Yeah, if you're anxious about the examination. Well, just remember, guys, anxiety, of course, is part of the experience, and it what makes you probably more focused um, during the examination. Yeah. For me, if I don't get nervous whenever I teach, I think there's a problem. So you're nervous, so no. Okay. Yeah, we are wishing you all the best. Neelam, your exam is end of the month. Okay. Hope you can join our final coaching. But But yeah, of course, good luck, good luck. Yeah, I'm just looking for the page that I'm going to discuss today. All right. So shall we start? Yeah. So for those people who just joining us, just type your where you're from or when you should exam on the chat box so we can. And of course, if you have any questions, please do type it on the chat box. If we have time, definitely we will answer some of your questions. Okay. All right. So what we'll do tonight, we will make like a quiz. Okay, we will do a quiz, or we will have like a conversation about about the different medication for the LSQ. We are just chill, yeah. We are just chill. Don't worry. I don't have a presentation. We will just discuss some medication. Have you heard for those people who are just starting their OSCE? So the medication for the OSCE, this will be useful when you do your implementation station, and of course, this will be useful for some skills because of course there are a couple of skill station which involves administration of medication. Okay, so in the UK, let me just go to the website. Okay, so in the UK, we are using. Have you heard of the BNF? Are you familiar? Probably for those people um, who's done the OSCE, I mean, who are about to take the OSCE, they're familiar. But for those people who are just starting their review, are you familiar with the BNF? Yes. Okay. Can you help me? What does it stand for? The acronym for BNF. If you can type it on the chat box. Okay. What does BNF stands for? Anyone? Before I share my screen. That's the answer, Shasta. So it's the British National Formulary. Okay, so that's what stands for. So in the UK, for those people who are not aware, we use this as our literature for medication. It's like if you're from the Philippines, it's like an equivalent of MIMS. Okay, so in the UK, we use this. Let me share my screen so you can see it. There you go. This is a screen. Okay, so this is what we use in the UK. So any medication, information about the medication, I mean the drug, indication from A to Z. It's all here. So what we use in practice. So typically in the UK, we use generic names. Okay, as compared to let's say America or other parts of the world, they used to brand names. Okay, of course in the NHS, probably most of you are working or will be working on the NHS. Probably yeah, you will be seeing a lot of generic names, generic medication. So British National Formulary. So this is their website. Yeah, if you want to check it yourself, it's this is their website. And of course we have like a book. Okay, so we also have like a book. I'm not sure. I think they change it every year, and then there will be like editions. Of course, um, definitely it's important to have your latest version of your British National Formulary. Emmer, question for those people. What? So I don't know if you can answer this question. Do you have BNF on the day of the exams? What do you think? Do you have the BNF on hand during the examination? What do you think? What did you learn during your training? Yes. Yes. Yes, according to May. Okay, that's correct. May, of course, um, we cannot remember all the medications. Yeah, how many medications do we have in the world? There are tons of medication, and of course, we cannot remember everything. But of course, definitely the more common we expect, probably you know it. Okay, so we will discuss the common ones today. All right, we'll discuss the common ones today. So during the examination, especially for during your implementation station, you will be given not an iPad. It's a tablet, okay? And I think an Android tablet, and you will be using that in case you need the BNF. During my time, feels like I'm really old. Yeah, during my time when I took the OSCE, we had the physical book. Can you imagine? Yeah, we had the physical book. So let's say I don't know what this medication is. I have to like check the page and go through all the pages. So can you imagine how many seconds, those precious seconds, wasted when I took the OSCE? Of course, I don't know all the medications in the world. Um, but now on your examination, you will be given a tablet because, to be honest, in reality, in real life, we have um you can just go to the BNF website when you're administering medication. You still have the physical book in practice, but of course you can just go to Google and of course go to reliable sources. Yeah, especially if you go to BNF website. And of course you're definitely your hospital or your care home. You have like a specific literature or like a link where to go. So that's it in real life. Okay, so let's discuss couple medication tonight. Okay, let me just see. All right. So what we'll do as a practice, let's see some. I'll tell couple of medication and tell me what the medication is for. Okay. We will find out together. Okay. So some of you probably know this, but probably some of you don't know what these medications are for. Okay. So as practice for the next, we still have an hour to discuss. Okay. Usually a PDF is available. What do you mean, Sofiana? Yeah, but during your exam, you will be given a tablet. Yeah, you'll be given a tablet. Are you referring to your hospital or your where you're currently working? I know some of you. Sorry, I know some of you are also working in um, care homes. There you go. So you have different policies. But care homes, you also have like because of course I worked in care home before. You also have tablets there. Um if you need it or the actual book. Okay, let's start. The first medication. So tell me what the medication is for. Are we ready? Okay, so put the answer on the chat box. Okay. The first medication is amlodipine. What is this medication for? Amlodipine. Some of you probably know this, but some of you probably it's your first time hearing this medication. Amlodipine. We have 1,000, I think 1,000 people watching tonight. Hi, May, antihypertensive medication. Well done. Okay. Well done. Let me just there you go. Hypertension. Um Oh, Sofiane, you're saying you can find a soft copy of course, definitely that's correct. Antihypertensive, well done, well done. For hypertension, well done. Okay. So the follow-up question is for those people who really know this, what's the actual drug classification of amlodipine if you know this? What's the actual drug, the drug classification of amlodipine? So it's indicated for hypertension, but what is the drug classification of amlodipine if you know this? We are just exercising our brains this evening, yeah? You won't get asked. This question will not be asked during your exam, but just in case. Okay, so what specific Sumay said beta blocker, Shasta beta blocker, a calcium channel blocker. How about the rest? For those, we have 1 million viewers tonight. What do we think? Uh, um, are we agreeing with Shwesta's answer or are we agreeing with May's answer? So the answer is let's find out. Okay, let's go to the British National Formulary. So if we type amlodipine, so well done. Shwesta says here it's a calcium channel blocker. Okay, it's a calcium channel blocker. Okay. It's for, well done, you're correct. It's for hypertension and angina. Well done. So normally 5 milligrams. So before administering this medication, what do you normally check? Or what will you normally ask from the assessor? What information do you need to know? Okay, before administering this medication, what information do you need to check with the assessor or with the patient? Not with the patient, or to check. Well done. Thank you for your answer, May, Shrestha. Hopefully the other guys could contribute as well. We will don't worry, this one is just the easy part. Yeah, we will make the medication harder. So May said, Joy, you asked the assessor to confirm the blood pressure. Well done. Okay, so during the exams, during the implementation station, you will not be performing blood pressure. Yeah, of course, it's during the assessment station. You will not be performing the blood pressure. You will be just, of course, asking the assessor what the blood pressure is or what the current blood pressure for your patient. Just remember this, guys. I know this is like some of the confusion for the nurses taking the exam. They thought that the blood pressure taken during the assessment station is still applicable for implementation station. Remember, guys, during the exam, the story of the question progresses. Yeah. Remember, during the examination, the story progresses. Probably you did your assessment station at 8 o'clock in the morning, and now you're performing or you're about to administer the 12 o'clock medication. Of course, during that time, probably the blood pressure changed. So it is important to check or ask the assessor once again what the current blood pressure of your patient. Okay, so hopefully that is helpful for the examination. All right, let's make it a bit. Let me ask you, shall we do easy, medium, or hard? Okay, medium or hard? Easy, medium, or hard? Let's try some like harder medication. Shall we do that? Shall we do that? Okay. Let's do a harder one, yeah? A harder medication. All right. How about the medication? Yes, hard. There you go. We like hard, isn't it? Sorry. Um, of course. So what is this medication? How about digoxin? Digoxin. Digoxin. What is digoxin for? Oh, I can see on the chat box that we have some channel members. Of course, I can see Easter. Nilam is also a channel member. Thank you for joining the community. All right. So, May said to control the heart rate. Okay. What is digoxin for? Okay. May said to control the heart rate. Can you tell me what is the drug classification of digoxin? I don't know if you know, anyone here knows what this is for. Shrestha said for arterial or atrial fibrillation. I think this sorry, I think you're delaying with the class. Okay. Eight antiarrhythmic. There you go. Let's see. Joy said digoxin is used to treat irregular heart rate. You must ask the assessor to confirm the patient's current heart rate before administering. Well done, well done. I love your answers. Well done. So, who can tell me what is the drug classification of digoxin? I haven't seen the answer. Digitalis. Well done, Easter. You're listening to the class last weekend. Okay, so digoxin is digitalis. Okay, so it's part of digitalis glycosides. Let's find out on our BNF. Okay, so we will find out together. For digoxin, there you go. True. Okay. Joy is seconding the motion or agreeing with Easter. Okay, it says here. What is this here? Let's go to the top. There you go. Digoxin. Digoxin is a cardiac glycoside that increases the force of myocardial contraction and reduces conductivity within the atrioventricular AV node. So, Emmer, do I need to explain that during the exam? You don't have to. Okay, just simply, of course, it's the for the heart to control the heart rate. Okay, well done. Okay, so question: what will you ask? What will you perform before giving this medication? So it's indicated um, uh, for AF, for heart failure. Well done. Okay, I love your answers. Well done. We normally check for the heart rate or the pulse rate before giving this medication. Let me ask you guys, what is the normal heart rate? Okay. What is the normal heart rate? Thank you for all your answers. Okay. Probably some of you, it's basic question, but again, not for everybody. Probably some of you, you haven't done nursing for quite some time. You're still revisiting, trying to remember everything. So this class will be useful. Okay, it's not too advanced. It's a mixture. So well done. So you have to check the pulse rate. Okay, because what is the normal? Well done, May. Thank you. The normal heart rate is 60 to 100. So you cannot give this medication if it's less than 60. Okay, so if it's less than 60, definitely, because it will cause bradycardia. Okay, there you go. Well done. Well done. You're still awake. You're still awake. Well done. All right. Let's do another one. Okay, so well done. Joy said less than 60, of course, should not be administered. All right, let's go on to the next medication. Let me ask you guys, easy or hard? Question. Okay, I'm referring to the question, not anything else, because we will get blocked. Okay. So, and next question, how about? Okay, so let's change it. Okay, let's change it. Basic, May. Basic. Is it basic or saying digoxin is basic or a basic question? Okay, let's do basic since we've done a bit of a more advanced medication. Let's see if this is basic for you, for everyone. How about ferrous sulfate? Ferrous sulfate. What is this medication for? Ferrous sulfate. Okay, let's see. Joy said it's for iron deficiency, for low iron. Well done. So definitely it's iron, isn't it? And a supplement. Let's see. Okay, ferrous sulfate. There you go. It's for iron deficiency. Well done. Thank you for all your answers. And it says here, typically for adults, 200 milligram once daily. And or it could be, sorry, my eyes are bad. You can see it on the screen. There you go. All right. Question: what's the common? What side effect will you tell the patient to look for or to watch out for or to be aware of when taking iron supplements? Okay. What should you tell the patient before when giving this? May said constipation. Any other guesses? Oh, we have 2 million watchers now. Okay. There you go. There's a new name. Kim's constipation. Um, Joy said, "Don't look at the BNF. Yeah, if you have your phones, don't Google it. Let's try and wing it. Let's try and guess the answer. Okay. Loss of appetite and constipation. Stain on teeth. That's a good one. There's a medication that could definitely stain your teeth if it's taken newborn. There is a medication. I don't know if you know this, but comment it on the chat box if you know this. Easter said constipation and the color of the feces will change. Sonu. So what color would the will the stool change into? Okay, let me share my screen so you can see it. All right. All right. So this is your parasulfate. Going back to the cautions, side effects. Kim said dark. There you go. This is also what I'm looking for as an answer. Okay. Kim said dark. So common. It says on the BNF, constipation, diarrhea, gastrointestinal discomfort, and nausea. Okay. It tastes like iron. I don't know if you've tasted. I mean, if you've taken parasulfate, it tastes like iron. Definitely, it tastes like rust. How did you know, Emmer? Have you tasted rust? I don't know. Probably. um. So yeah, and of course, the feces could change. Dark stool, definitely. Dark stool. There you go. Well done. Well done. Okay. Well done. Thank you for your answers. Yeah, keep coming. Keep coming. We still have an hour to go. All right. So we still have more medications to talk about. So quick question. There are 8 scenarios during the exam. Yeah, there are 8 questions. And 8 questions. Sorry, there are 8 scenarios during the examination. Which scenario do you think this will appear? I will not confirm it, okay? I will not confirm it. But which scenario do you think this will be relevant? Okay. So let's recap. What are the scenarios for the OSCE? It's on the website. Yeah, it's on the website. So we have pneumonia, you have your asthma, you have your depression and anxiety, you have your malnutrition, you have your ectopic pregnancy, you have your colon fracture, you have your hernia, you have your what else? What else am I missing? Your dementia, your Alzheimer's scenario. Which scenario do you think this will appear? Ectopic pregnancy according to Joy. Okay, that's a good guess. That's a good guess. Um, May said malnutrition. Shrestha agrees with May. How about the others? What do you think? Which scenario do you think it will appear? So those are good guesses, yeah. Ectopic pregnancy, malnutrition, definitely, yeah. Well done, well done. Okay, I will not confirm, but it may appear in those scenarios, of course. Well done. But again, you'll never know. It might appear in other scenarios as well. Um, Quick question. I don't know if it's here. Tooth discoloration. Well done. I think someone answered about tooth discoloration. Someone answered about teeth or tooth discoloration. I can't remember, but I think I saw it somewhere. Yep, someone answered about this. Well done. Me, May, of course, May. Well done, May. Okay, so see, you can see it on the screen. Okay, well done. All right. So, question: before when you give this medication, should it be taken with like an empty stomach or with a full stomach. It's on the screen, but let me just scroll up. Okay. For iron supplements for ferrous sulfate, should you take this before meals or after meals? No one can answer me. Okay. So May said empty. Let's see how about the rest. Okay. How about the rest? So I will not tell you the answers now. Put it on the comment section. Yeah. For those people who's watching this late, put it on the comment section. Okay. If you agree with May or with Sakura, that's a nice name, Sakura. Sakura, are you from Japan? I'm just kidding. Um, After meals, according to Sonu. Okay. Empty stomach, according to Easter and Shasta. Let's see. So, I will not confirm now, but grab your BNF later and then put it on the comment section below, right? So we will see what your answers are. All right, next medication. Okay, so to summarize, ferrous sulfate, definitely it's for iron deficiency, for anemia, and according to you guys on your comment, probably ectopic pregnancy or malnutrition. Those are good guesses. Um, from the Philippines, Sakura. Well done. Thank you. Thank you for joining us this evening. Yeah, there you go. But a very nice name. I do watch Naruto, so I love the name. All right. And then you said common side effect would be constipation. It also says on the BNF diarrhea. And of course, you said it could cause black stool. Okay, black stool. All right. Well done. Let's move on with the next medication. This is basic. I think okay, Easter said we learned from school. It's given best with orange juice is still right. Okay. So put it on the comment section. Okay. So we have like a nice conversation in the comment section. Yeah. So is it an empty stomach or is it a full stomach? Easter, there you go. Well done. I don't know if I mentioned this during our final coaching, but there you go. Next medication. Okay, shall we do hard? Okay, shall we do hard? Shall we do hard? Neelam said with food. Next medication. How about furosemide? What time is it? Furosemide. I hope you're enjoying our session. Yeah, I hope you do enjoy our session. Sorry, I meant to use another camera today, but for some reason, it's not the system is not accepting the feed. So that's why I'm using a low quality camera today. Yeah. So um, I hope I'm clear. Yeah, I'm clear. You love my lighting. Yeah, you love my background. Okay. All right. We are all now thinking. We are all now thinking. I know probably some of you are tired after a long day shift, but thank you for joining me. Yeah, I'm enjoying it as well. So May said, you're now awake again, May. Yeah, for those people who cannot understand the thing on the screen, she said, she's now awake. All right. So let's see some answers. Joy said, furosemide, it's diuretics. Do you agree with May? Sonu agrees with May. He said, diuretics to reduce edema for edema and hypertension. That's very well done. So Easter said water tablet. I can tell that Easter is in the UK for a long time. Yeah. So in the UK, um, some people refer this, especially like people who doesn't know like medical stuff, yeah, they normally refer diuretics. Yeah, diuretics. They call it as a water tablet. That's very good, Mister. Yeah, for those people who are new to studying or new to the country, or you're still. I mean, I know some of you are from the Middle East watching now. So if you hear someone tells you that it's a water tablet, or let's say a patient asks you, "Where is my water tablet?" They're referring to the diuretics because what's the side effect of furosemide? So what's the side effect of furosemide? Frequent, Joy said frequent urination, excessive urination. Anything else? There are one more side effect. Well done, that's correct, yeah? Um, there's one more. Polyuria. Polyuria, frequent urination. There you go. What else? Because it will eliminate those excess fluid from the body through urination. So well done. Any other side effects? So well done. Lovely. I love your name. How many? May, it's also May. May said decrease in blood pressure or hypotension. Do you agree with May? Does furosemide cause um hypotension? Do you agree with her? There's one more. Okay, there's one more. Whenever you take furosemide, well done. So no, this is what one of the side effect I'm looking for. So what electrolyte will you lose when you take furosemide? Okay. So what electrolyte do we lose when we take furosemide? Let's try and remember our May said potassium. Do you agree with May? Sodium too. Okay. So Shrestha said potassium. Hope Sakura potassium. Well done. Let's see. Let's see. Okay. Easter agrees with everyone. Okay, with everyone. Or I don't know if you agree with everyone or with their answers. Let's see. Okay. Let's see. Let's find out together. Okay. In your country, what's the brand name for furosemide? Okay. In your country, what do you? I mean, what's the common brand name you know of for furosemide? Lasix. Well done, Lasix. May. Any other brand names that you can think of? I only know Lasix to be honest, but I don't know if in your country you might have like a leading brand name. Of course, this is not sponsored. So let's see, furosemide. All right. So furosemide is specifically categorized or classified as a loop diuretic. Okay. So because it acts on the loop of Henle. Are you familiar with the loop of Henle? Let's try and recall our anesthesia. Yeah, the loop of Henle. There you go. It says here the loop of Henle. There you go. I'm not lying, sir. Um, it inhibits the reabsorption of from the ascending limb of the loop of Henle in the renal tube. That's why it inhibits the reabsorption. That's why you will urinate those fluid. Okay, you will eliminate those fluid. Okay, so you can take it by mouth, or of course, it can also be given. It says here intravenously or intramuscularly. Okay, that's your BNF. Well done. For edema, for hypertension, definitely contraindications. Okay, it's here on the screen. Just pause this and read it. Those are the contraindication. But the common one, of course, it is important before giving this medication. We check the blood pressure. Okay, we check the blood pressure. Um, there you go. All right. It can cause. So you are correct. Sonu said they also you also know it as of course Lasix. Well done. So potassium loss because it's also a potassium um wasting diuretic. Okay, it's a potassium wasting diuretic. Well done. So can you tell me guys? Can you give me an example of medication where it's a potassium sparing diuretic? Okay, can you think of a diuretic where it's a potassium sparing? It's not it will not appear in the exam, but of course in real practice, okay, you might see this. Can you give me a medication that is potassium sparing? When you take it, the patient or when the patient takes this medication, they will not lose potassium. May I can tell that you are really awake tonight. So spironolactone. There you go. Spironolactone. Let's have a look. Okay. This is not common on the exam, but just of course, I mean, why not? Let's discuss it. Okay. Spironolactone is a potassium. It's also a diuretic, but this one is potassium sparing. Okay, so you will not lose, so your patient will not lose potassium when they take this medication. Well done, Joy. May also got it correct. Joy also got it correct. Well then, I hope you're enjoying. Okay, let's do another one. Shall we do a hard one? I know it's pyrosimide hard. So, what blood pressure will you not give furosemide? Okay, what blood pressure? I mean, what range probably? What is the normal blood pressure range? You have your exam next week, Joy. Good luck. Yeah, good luck. Good luck. Thank you for answering and staying with me tonight. I can see we have 3 million watchers. There you go. I hope you share this with your friends and invite them to come and join us this evening. Why not? So, May, you will give this if the blood pressure is probably within the normal range. Yeah, well done. Well done. Well done. Of course, you cannot give it if the blood pressure is too low. Typically on the exams, they don't normally tell you, let's say when you ask for the blood pressure, they don't normally say a specific number. Okay. They normally just say it's within the normal range or if it's outside the normal range. Okay. So, you're welcome, Joy. Good luck. Yeah, good luck. All right. Let's carry on. So of course, during the exam, if you see furosemide, ask the assessor with the current blood pressure of your patient first before administering it. And of course, part of your health education or when you tell what this medication is for, it's probably for hypertension and it may cause frequency of urination because the patient will lose the excess fluids. Okay, so well then you said earlier that it may reduce edema. Well done. It's also for heart failure, it says here. So, what do you think the scenario that this may appear? Okay, that's a good question. That's my question. What do you think this medication will appear? I think there are two, but can you give me a guess? I think this will appear in two scenarios, but give me a guess. Give me, put your comment below. What scenario do you think this will appear? Let's have an educated guess. So we have Shasta. I love your answer. I will not confirm, but that's a good guess, of course. Why not? Yeah, cardiac failure. Okay. What else? There's another one. Female MI. So on the exam, that's a good guess. Of course, May. On the exam, yeah, of course, if one of the scenario probably they had like MI before, or they have not necessarily MI, or let's say they have heart problems, heart failure, probably they must be, this may appear. Okay, but let's have a guess. Put your comment on the chat box or on the comment section once the live video finishes. So this live video will stay on my YouTube channel so you can revisit it. So for those people who's watching this in the future, hello. Okay, thank you for watching this. Hey, let's move on with the next one. How about this one? Shall we do a hard one? How about glucosamine? How about glucosamine? Give it a try, okay? Glucosamine. Okay? Give your best guess. Give your best shot. What do you think the indication of this medication? Okay? Glucosamine. What's BS, May? Sorry, I'm not sure about your abbreviation. BS. What's BS? Is it the swear word? No. Are you saying bad words, May? No, no. Blood sugar. Okay, all right. Blood sugar, glucosamine. Because probably you incorporate or you because you hear the word glucose in it. So unfortunately, it's not the answer, but nice try. So, guys, for those people who's watching this video, I mean, who's starting their journey in the UK, so we don't normally call what do you call this? Blood sugar monitoring as CBG. Okay, we call it to say if you want to check the patient's blood sugar. What do we normally call here in the UK? For those people who's here in the UK already. But yeah, if you know the answer, yeah, glucosamine. Let's see if you can Google it. Grab your phones. Try to Google it. What is this for? Okay, so if those for those people who's watching this in the future. Oh yeah, well done. Thank you, Shrestha. Yeah. So in the UK we call it BM. Okay. BM. I thought, you know what? There's like a story here. BM, I thought it means blood sugar monitoring. Actually, it's not. Okay. Actually, it's not. It's a brand. Okay. It's a brand. So, um, I'll just ask you, if you know the answer, what BM stands for. Okay. Um, because yeah, in the UK, when someone asks you, "Can you please do the BM?" I really thought BM stands for blood sugar monitoring, but it's not. It's actually a brand. But of course, they're referring for you to check the blood sugar of the patient. Yeah. If someone asks you, "Can you please do the blood sugar?" Can you please do the BM? They're referring to blood sugar. Yeah, not bowel movement. Okay, not bowel movement. But you know what, my friend, he's a clinical nurse specialist for diabetes. He said BM is not blood sugar monitoring. BM is actually a brand. Okay, so if you can research that and put it on the chat box. Okay, if you can put it on the chat box. All right, so going back to the original question, let's find out, okay, what glucosamine is for. Okay, so if this is your first time hearing this medication, congratulations, because today is not the exams. Okay, so you might see this on the exam. Google said amino sugar. So what is that? Is it sugar? I think you're all still young because you don't know what this is for. Okay, you can see my screen, yeah? Okay, so glucosamine. Glucosamine is for symptoms relief of mild to moderate osteoarthritis. There you go. Well done. Sonu, he found the answer for osteoarthritis. Okay. On the exam, there are a couple of people. Supplements for the bone. There you go. Well done, everyone. So yeah, well done. So luckily today is not the day. Luckily today is not the exam. Okay. So we learned something new today. Raise your hand if you learned something new. Of course, my mind. If you learned some like a new medication tonight, yeah. So, glucosamine, according to the BNF, it's a symptomatic relief for mild to moderate osteoarthritis. Okay, hopefully you'll remember this medication. Okay, um, I hope there you go. Joy learned a new medication tonight. Okay, well done. So, I hope you enjoyed that for glucosamine. Okay, so well done. You can see it on on my screen. So there you go. That's your glucosamine. All right. Let's do another medication. I think some of you are a bit late. That's why you're still answering my old question. Um. Okay. Let's do another one. How about? Okay. How about this medication is simple, but it will appear multiple times, including other stations, yeah? How about ibuprofen? Okay? How about ibuprofen? What is this medication for? Okay? Ibuprofen. Ibuprofen. In the Philippines, we call it ibuprofen. Okay? So ibuprofen. Okay. I thought, you know what? May said analgesia. I thought I was reading your comment. I thought you said ibuprofen is for pain and fear. There you go. Why not for fear as well? If you're afraid, take um by ibuprofen. So yeah, pain and fever. She said. Okay, all right. Used to treat pain and fever for pain and inflammation. So now, can you please tell me, guys, what is the drug classification of ibuprofen? What is the drug classification of ibuprofen? Easter said, Easter said, it's an NSAID. What does NSAID stands for again? Your non-steroidal anti-inflammatory drug. Okay, so well done. All right. So when should, I mean, can we take ibuprofen on an empty stomach, or with shall we take it with a full stomach? Okay. So well done. Thank you. It's a non-steroidal anti-inflammatory drug. It's for pain, of course, for fever. Okay. So let's go to one of your scenarios, which is like your evidence-based practice. Okay. There is some evidence-based practice about your ibuprofen. When I mean, will you take it with empty stomach or with full stomach? So yeah, well done. So you said full full stomach, full stomach. Well done, Nilam. I think Nilam is still answering my old question about glucosamine. So well done, well done, well done, well done. I can see that you're actually reviewing. Yeah, you're ready for the exam. So according to the evidence-based practice, if you've seen the marking criteria there, it says there ibuprofen. I mean, let's see. Let's find it on the. Let's say before I move on. Let's see. Ibuprofen is for indicated for pain. What else? Migraine, says here migraine. Pyrexia, of course, fever with discomfort, says here. For pain and inflammation, of course, well done. And the rest. So we normally take ibuprofen with food, definitely. So on the exams, definitely you tell the patient have this with food. Of course, it could cause um, gastric upset, of course, if they take it. But according to the evidence-based practice, you can take. I saw the answer. There you go. From May, she said you can take it with an empty stomach, but only for a short time, only less than 7 days. Well done. Okay, so if you check your marking criteria, if you go to which topic is that? Which topic is that? I think it's about fever with children. Is it fever with children? Am I wrong? Am I correct? So if you go to your marking criteria and if you go to fever with children, one marking criteria discusses that ibuprofen can be taken with with or full stomach or an empty stomach for short term only, okay, for less than 7 days. But of course, the patient we don't. I mean, if they can take some food, definitely just take it with meals. Okay, well done, Nilam, well done. There you go. All right, fever in children. There you go. That's the scenario. Well done. All right. Oh, all right. Additional question for ibuprofen. I know it may seem basic, but this will be useful during the exam. For evidence-based practice again, it's contraindicated for which people? Okay, it's contraindicated for. Let's see. Ibuprofen is contraindicated for. If you type the answer, well done, well done. For people with asthma, because according, well done, also correct. May Well done, Shasta, well done. You are ready for the exam. So it says on the marking criteria, especially for people with asthma, ibuprofen is contraindicated because it could cause bronchospasm. Well done. Yeah, there you go. See, I can see you. Risha, well done. Okay, so it's contraindicated for people with asthma because it could cause bronchospasm according to the professional, I mean, for to the evidence-based practice. There you go. Additional knowledge for everybody. Um, so thank you for all your answer. I hope you're really enjoying our session. Yeah, I hope you're enjoying our session. I'm enjoying as well. Unfortunately, I cannot hear your voices, but I'm just relying on the chat box. Okay. All right. Let's do another one. All right. How about let's do a hard one? Yeah. Let's try to do a hard one. Let's do a hard. Okay, you're enjoying. Well done. Okay, thank you. How about? Oh my God, I've lost all the medication. How about? I'm losing medication. Hang on. How about let's do a hard one. How about this? I think this I mean the people who joined the class last time they know this medication now. How about oxybutynin? Okay. How about oxybutynin? Okay. How about oxybutynin? For those people who joined the class, our file coaching, don't answer. Yeah. Let's see those people um if they know it. May said it's an anesthetic. Okay, that's a nice guess. Okay, let's see what others think. Oxybutynin. Okay, let me just put the spelling on the screen. Yeah, you're a bit behind, Nilam. Okay, all right. Let's see. Renal. There you go. Shrestha said it's to treat overactive bladder. Do we agree with Shrestha? Joy. Joy said it's used to decrease muscle spasm of the bladder and reduce frequent urination. D, how do you say your name? WD, urinary incontinence. All right. How about others? Or what do you think? Try to answer. If you're shy to chat, to put your answer on the chat box, try to answer in your head, yeah? What do we think? All right. Let me show it on the screen. So it says here, well done. Urinary frequency. Urinary frequency, urinary incontinence, neurogenic bladder instability. Normally, uh, they prescribe it to patients with overactive bladder. Okay, there you go. All right. So it's urinary frequency because of the bladder, not because of diuretics. Yeah, not because of. I mean, you're getting rid of the excessive fluid. It's because of the bladder itself being overactive. There. All right, well done. Says here for overactive bladder, nocturnal enuresis associated with overactive bladder. At night, so the bladder is overactive at night. So there's like excessive um, urination at night. Well done. Okay, so um, the actual drug classification of oxybutynin is it's an muscarinic. Okay, as you can see on the screen, it's an anti-muscarinic. Well done. Well done. So Joy agrees with me. Okay, thank you, Joy, for agreeing. And Joy is my favorite now. All right. Anti-muscarinics, yeah? So well done. Well done. All right. Did you know, I mean, raise your hand if this is your first time hearing this medication. Okay, raise your hand if it's your first time. Do you know what? I'm also not familiar with this medication um until the scenario was introduced. So, Joy, you're my favorite, of course. Okay. All right. There you go. So, Congratulations if you learned something new tonight. Okay, so if you learned oxybutynin, it's your first time um hearing this medication or learning this medication. Well done, congratulations. Okay, we learned something tonight. All right, next, let's do another one. We still have time. Okay, how about how about clarithromycin? Okay, clarithromycin. What is this medication for? Clarithromycin. What is this medication for? So May said it's an antibiotic. Well done. But can you please tell me what type of antibiotic? That's my most important question. So May and Tresha said it's an antibiotic. But what type of antibiotic is this for? Can you give it to someone allergic to penicillin? So you said, yeah, well done. That's correct. It's an antibiotic. But what type of antibiotic is this? Can you give it to someone allergic to penicillin? So May said no. Shrestha said yes. Love said yes. Easter said it's antibiotic. What? So I'm still looking for the answer. What type of antibiotic is this? I still can see the answer. There you go. Well done. So love. That's a very nice name, love. I hope someone will call me love too. So love. She said it's macrolides. Do we agree with love? Okay, let's agree with love. How can you be wrong with love? Yes. Yes, we agree with love. Well done. It's a macrolide. So, going back to my other question, can we give this to someone allergic to penicillin? Okay, let's go to the BNF. Let's type. Yes, it can be given. Well done. I love your answers. So, well done. Thanks, love. Thanks, joy. Yes, it can be given. So, if the patient is allergic to penicillin, you can give clarithromycin because we learned today that according to love, clarithromycin is a macrolide. Okay, it's a macrolide. Well done. Okay. So these are the indication of this medication. It says here, um, what are the medications for infection, for cellulitis, eczema, pneu- pneumonia. It says here, respiratory tract infections. So those are the indication of this medication. All right. We have loads. Okay. So if on the exam, if the patient is allergic to penicillin and then you see clarithromycin, remember you can still give this medication. Yeah. Because I remember some people, a lot of, I mean, there are a couple of nurses who really, I mean, they were doubting themselves. Can I give it to someone allergic to penicillin? Remember, it's an antibiotic, but it's not a penicillin. It's a macrolide. Well done. Well done, everybody. All right, let's do couple more. Why not? How about okay? All right. How about this? This is a simple medication, yeah. How about co-amoxiclav. So we know this is an antibiotic, but what type of antibiotic is this? Co-amoxiclav. It's also known as, I think, Augmentin. That's the brand name. Okay, what type of antibiotic is amoxiclav? Penicillin. Love said penicillin. Do you agree with Love? How can you not agree with Love, isn't it? I think the next session, we talk about Love. Antibiotic contains penicillin. Penicillin. Well done. Well done. Thank you for your answers. Well done. Okay. But so just a quick question, yeah. It's co amoxiclav. What's the co? It's a combination of medications. It's normally 500 per 125 milligrams. It's a combination of medication. So, comoxiclav is an antibiotic from the penicillin group mixed with clavulanic acid. Okay? That's your comoxiclav. Of course, you cannot give it to someone allergic to penicillin. Okay? That's just remember that. Okay. Let's do another one. Why not? Combination. Well done. May agrees with me. How about, all right, this one. Let's go to some of the medication for the skills. How about hydroxocobalamin? It's also known as, okay, hydroxocobalamin. It's also known as, okay, I hope you're still awake, yeah? We have 2 million viewers tonight. Oh my God. Just, guys, please like this video, or subscribe to my channel if you just joined this live stream. Click the notification bell so you know when I'm going live or when I'm going to post a video. Please do follow my social media. Social media handles are there on the website. If you have any queries about the OSCE, just you can drop me an email. Yeah, I will try my best to answer because I'm really sorry. I do receive a lot of emails, but I will try and answer all your questions as soon as possible. Just bear with me. Okay. Um. So, all right. Your answers. Vitamin. So hydroxycobalamin is also known as your vitamin B12. Well done. Vitamin. I can see your answer. So you said it's for anemia. What type of anemia? What type of anemia? Because remember, we have different anemia. What type of anemia? What type of anemia? So, Love said for pernicious anemia. Did you agree with Love? Okay, let's find out. Follow-up question. What's the common, I mean, apart from, of course, hydroxycobalamin, um, what's the food source of vitamin B12? Where do you normally see vitamin B12? Pernicious anemia. There you go. So hydroxycobalamin, the indication is it's for microcytic anemia, for pernicious anemia, of course. Well done. Here you can see it on the screen. Vitamin B12 deficiency, of course. Okay, so you can see here the side effects. on the screen. All right, I will not read it. You can just pause this video or go to the BNF. So, question: where do you normally find? I mean, what's the food sources meat according to Easter? Do you agree with Easter? Ed, do you agree with the answer? Do we get vitamin B12 from meat products, dairy products? Well done. Well done. All right. Well done. So during your examination, so you will find this medication during, I mean, you will administer this medication during IM, and so you will be giving it intramuscularly. Okay? Intramuscularly. So to your patient. So practice this. It says here for adults, can you see it on the screen? For adults, you normally give it 1 milligram every 2 to 3 months. Okay, so for IM injection, we normally give hydroxycobalamin 1 milligram every 2 to 3 months. Okay, and so normally 1 milligram per ml. Okay, so if you're asked to give 1 milligram, of course, it's 1 ml. Of course, I mean, always check your medication vial. Okay, what's your stock dose during the examination? So you will be using your basic calculation during the day. All right. Okay. Another one. All right. This one is easy, but let's see. Salbutamol. Salbutamol. What is the drug classification of salbutamol? Salbutamol. Thank you for your answers. Joy said it's for asthma, for COPD. Well done. So, bronchodilator. Well done. Bronchodilator. Okay? Bronchodilator. Well done. There you go. So, what's the common side effect? Okay? When your patient, I mean, receives this medication, especially let's say for the first time, what will you tell them that they might experience? Okay, when you give salbutamol, probably let's say it's your first time. I mean, it's your first time receiving this patient, this medication. What do you think you should tell them? What's the common side effect? So, Joy said shakiness and dry mouth. Do you agree with Joy? Love said headache. Joy, palpitations, dryness of the mouth. Let's see. Let's see. So one of these common side effects is Destin said palpitations. Well done. So yeah, palpitations and tachycardia. So it's indicated for. I'm just checking if you're still watching. Yeah. So there you go. So it's for asthma according to the BNF. Um, let's see. All right, let's see. So the most important thing, well done. Let's see your answers. There you go. Your answers on the screen. Let's see. I cannot read it. There you go. Common side effects. Common or very common. Arrhythmias, headache. So well done for those people who answered it. Palpitations and tremors. Okay. So common. I mean, it's very common. Definitely this four. Yeah, and palpitations especially. I did experience this myself. Yeah, but my first time having salbutamol ever in my life, I really can feel my heart. Yeah, it's beating. Okay. So palpitations. palpitations, definitely. You need to tell the patient that. Okay, so on the exams, if in case you will see salbutamol prescribed, that might be those are the important information that you might be telling the patient. Oh, Trafalgar is back. I remember Trafalgar. Um, hello. There you go. Listen up, people. Neelam, well done. Just logged in. You missed the fun part, Trafalgar. Okay. All right. So yeah, definitely palpitation. So you will give this medication during administration of inhaled medication. There you go. During the administration of inhaled medication. All right. So definitely, that is not our topic tonight. So make sure you give the instruction on how to give the medication. Okay. So your there you go. Okay, your the proper technique. So there are two techniques there for those people who just started their study for the OSCE. We have two techniques. Um, you can select which one is appropriate to your patient. Again, only one. Only one. You only need to give one. All right, let's move on with the next one. We still have time. I hope you're still awake, guys. Yeah, I hope you're enjoying our session. Again, you can play this video again and answer along. Yeah, try to study with me, study with everybody. So again, if your OSCE is very soon, good luck. There you go. Joy said, well done. Joy answered the question. You have your tidal breathing, tidal, and then your multi breath technique. Well done. Well done. All right, let's do a couple more medication. How about morphine? How about morphine sulfate? Just remember, guys, whilst you're answering the question, you will not give inhaled medication during implementation station. Yeah, you may see salbutamol, but of course, you will only administer oral drugs during implementation station because you have a separate station for for inhalers. Okay, so just remember, bear that in mind. You might see it on the drug chart, but again, it might probably it was given by a colleague, or it's not due, or it's not needed. Okay, so well done. I can see answers. Um, opioid. Opioid for severe pain. Analgesic for severe pain. Well done. So morphine is an opioid. Opioid. There you go. It's a controlled substance. Okay, it's a controlled substance. Well done. All right. Question for morphine. What's the common side effect of morphine? Okay. What's the common side effect of morphine? There are a couple. So number one, what do you need to watch out for before giving this? And what's the common side effect, especially for long-term use? Okay, especially for long-term use. Trafalgar said constipation and decreased respiratory rate. Well done. Okay, so definitely make sure to check the patient's respiratory rate first before giving morphine because it could cause further decrease in heart rate. So well done. Okay, so side effect. When you take morphine like prolonged period of time, it could cause constipation. Well done. So that's why normally if your patient receives morphine, there is like also a regular medication prescribed for constipation. Okay, so normally if your patient receives these types of medication, you will also see a PRN or a regular laxative. Okay, this is not part of the exam, but let's just ask you guys if you still know this. What's the antidote for morphine toxicity? Okay, what's the antidote for morphine toxicity to counteract morphine toxicity? Why not? Let's discuss some antidotes, yeah? If you know this, who can tell me? Let's see. I cannot see the answer yet on the screen. Um, who can guess? What's the antidote for morphine toxicity? What do you know? What will you give the patient? What will you give the patient? There you go. I saw the answer on the screen. Well done, D. It's naloxone. Well done. So naloxone is your antidote for morphine toxicity. Don't worry, it's not part of the exam, but just of course, why not? Why not? Let's discuss that. All right. So morphine, you might see this on the exam. Of course, for severe pain, it's an opioid, a medication. Check respiratory rate before giving this medication, of course, and definitely you talk about constipation as one of the side effects. That's why normally doctors will give um, laxative when the patient receives this medication, especially long term. All right. Let me show it on the screen. Let's have a look. Okay, that's a good question. That's a good question. So, do we give morphine in the implementation station? Yeah. So, in the UK, the practice when you're giving controlled drugs, of course, you need two people. Okay, so you need two people in giving this medication. Definitely, that's good thinking. Well done. So probably on the exam, it was given already. Okay, it was given already. So think of the alternative medication. It may still be part of the drug chart. Probably it was given or not required. Okay, so but again, good thing that we're discussing it. But yeah, well done. Good thinking. Let's do another one. Shall we do a hard and easy or medium? We still have last one before we end the night. Shall we do a part two next week? Yeah, or let's do another topic. Okay, so all right. So if you have any suggestions, because of course we have to call it a night now. If you have any hard, okay, Joyce said hard. Okay, so if you have any suggestions for the next topic next week, we will do it again on a Wednesday. It's Wednesday today, right? So we'll do it again on a Wednesday. So if you want like a part two of the medication, if you enjoyed this session, please put, I mean, of course, like this video. Put in the comment, put your comment is definitely. And if you have any other suggestions in terms of topics, again, please write it on the chat box or comment down below. There you go. So we can discuss it next week. Yeah. If you want a part two of the medications, why not? Sonu, he's got a nice question, right? Before I give again, part two, please. Okay, let's. If you want part two again, just comment on the chat box. I will think about it over the weekend. Yeah, so we can do a part two next week. Or if you don't, I mean, if you did not enjoy this session, if it's too basic for you, let's do another session, a different one. It could be planning. Okay. Yeah, that's true, Trafalgar. We don't have a video for wound assessment. It could be our next topic. Okay, it could be our next topic. And suctioning, there you go. You need to convince. I need some actors. Yeah, I need some actors. All right. So all right. What am I discussing? So yeah, another medication again before we close the night. So let me think of another medication. But again, if you enjoyed this one, please like the video, subscribe, and of course, if you want a part two, why not? Okay, convince me on the comment section. So let's do another drug session next week. Or if not, give me other suggestions. All right. To end the night, we could discuss some skills next week. I won't be able to demonstrate it though. In Braden, oh my God, Braden. I know, to be honest, you know what? I'm receiving a couple of emails about the must. Okay? There are a couple of people who are failing the must. I do understand it's very confusing. Yeah, it's very confusing. We can discuss that again. Okay, I know I have a video about mask, but let's do like a newer version, an updated lecture. It could be next week, but yeah, tell me what you think, and we will discuss it next week. All right, to end the night, to end the night. I'm just thinking which medication. Yeah. How about how about how about? I'm still thinking. How about how about chlorphenamine? Okay, this is my final question or medication to end our night before we say good night. Chlorphenamine. Chlorphenamine. Still have um 2 million viewers this evening. Love said for allergies. Do you agree with love or you have other answers? What is this for? Chlorphenamine. What do we think? Do we agree with love? Do we agree? Yeah? For allergy. Let's see. Let's find out together. How do you spell it? Chlor. Chlor. Okay. Yeah, most of you said for allergy. Okay, let's see. Here on the screen, you can see it's for symptoms of allergy. Well done. Well done. Well done. Where it says here emergency treatment of anaphylactic reactions for children. For hay fever. For food allergy, drug reactions. Well done. So question, which scenario do you think you will see this? Give me your wild guess. Oh, son, no, sorry, I didn't see what your question. If you can repeat your question, yeah. Sorry, I didn't see it. Repeat your question, please. But yeah. So going back to my question, which scenario do you think this will appear? Give me your wild guess. So let's recap the scenarios. We have exacerbation of heart failure. You have your malnutrition and diabetes. You have your anxiety and depression. You have your pneumonia, your asthma. You have your fall and fracture. You have your end of life. You have your homelessness. You have your fall and fracture that I mentioned. It's hernia. You have your ectopic pregnancy. Give me your best guess. So all the medication that we discussed tonight, you might see them on the exam. Yeah, I tried to pick at least one of each scenario, so it will be helpful. So love said homelessness. That's a good one. Why not? Anxiety, according to D. What else? Where else? What other scenario can you think of? Do you agree with? What do you agree with? Okay, so put in the chat box. Okay, at least for those people who didn't know what chlorphenamine was, at least we learned something new tonight. Yeah, at least we learned something new tonight. So, ok, here you go. I'm really sorry if I'm saying this wrong. He said asthma, or she said, I don't know if you're a he or she. Sorry about that, or a they. I'm really sorry. Asthma. May also said asthma. Well done. Okay, so let's see. So at least regardless of the scenario, at least now you know what chlorphenamine is. For those people who just learned this medication today or this evening, again, congratulations. We learned something new tonight. That's the most important thing. We learned something new, okay? And we keep learning. and we keep learning. That's the most important thing. All right. So, oh yeah, let's go back to Sono. Sorry, he's asking this one. How much gap required between morphine and other analgesic? Okay. Who can help me answer this question from Sono? What's the gap between morphine and other analgesia? Okay. Let's answer this hard question. This is a hard question, Sono. You're giving me a hard one. Okay. So anyone from the group, we have 2 million viewers. Okay. I'm a live seller. I'm selling my cup. Okay. This is 300 pesos if you want to buy this. Just say mine on the comment. Yeah, just say mine. All right. Just kidding. So yeah, if you if you want to, let's share our thoughts before you end the night. Yeah, let's help Sonu. He might not be able to sleep tonight if you don't answer this. Yeah. All right. These said 2 hours. What others think about this question? So let's say let's give an example. Let's say morphine and paracetamol, morphine and ibuprofen. Let's say morphine and what other medication can you think of? Codeine. Okay. We'll say morphine and any other medication for pain that you can think of. All right. So let's read your comments. Okay, keep your comments on the chat box. Some of you, Shrestha said they said 2 hours. Shrestha said some analgesics can be given together. Would you agree with Shrestha? Love said 6 to 8 hours. Easter said you can give it together. Why not? Love said it can be given together. Neelam said it depends on the prescription. Um, Jan said it depends if the patient complains of the pain. PRN can be given if different types of pain meds. Okay. Let me just ask you guys: have you ever encountered a patient or a prescription wherein the doctor asked you to give two painkillers at the same time? Have you ever had a patient wherein you've given painkillers at the same time? Okay, I don't know if you recall. Have you ever had the patient because the patient is really in real pain? The pain is really high, and the patient receives regular medications round the clock. Have you ever experienced that you're giving two painkillers at the same time? No, you haven't experienced it, or anyone experienced it? Raise your hand. Try to remember your experiences before, okay, or your current experience if you're still working. Definitely, if you're still working as a nurse, yeah, or your previous experience in your home countries, yeah. Have you ever had a patient wherein the patient received two painkillers at the same time? Yes, love. Yes, well done. Remember, let's recap. Yeah. Yes, definitely, definitely. So remember, of course, going back to Sono's question, of course, you cannot give morphine. There should be like back to back. Yeah, definitely you have to follow the prescription. Okay, so this is your assignment. Okay, how frequent can you give morphine? Okay, how frequent can you give morphine? So of course, let's say another medication. Remember, morphine is an opioid medication. Remember, ibuprofen is an NSAID. Paracetamol is acetaminophen. Okay, remember what we call this? Painkillers, they have different drug classification. Of course, you cannot give, same at the same time. Definitely, it should come from a different drug class. Remember, I don't know if you remember this. Remember, for pain, we have the ladder. Can you remember the ladder for medication? So have a read on that. We will not discuss it tonight, of course. We are a bit late now. Okay, so try to think. Search for the ladder when you're giving your medication. Remember, there's like level 1, 2, 3 on how to give medication. Of course, you cannot give the medication at the same time. It's similar when you're giving your medication for the blood pressure. Yeah, they say. Remember, for patients, sometimes they receive 2 or 3 or sometimes more medication for the blood pressure, isn't it? But they come from different drug classification. You cannot give, same medication or same drug class, yeah. But of course, you can give if it comes from different drug classifications. Say paracetamol, and then you're giving morphine. Of course, why not? Yeah, you can give it together. But of course, you cannot give, I mean, medication, same classification at the same time. All right, I hope that's clear. Yeah, I hope you agree with me. Okay, because remember, similar with your remember for your blood pressure medication, sometimes patient they receive three antihypertensive medication at the same time. But of course, those three medications they come from different drug classification because of course it will cause overdose. Yeah, it will cause overdose. Okay, remember for each medication, you only have a limit per day. Okay, you only have a limit per day. So make sure do not exceed that. Okay, let's say paracetamol. I won't answer it, but this will be just put in the comment section. What's the maximum dose of a paracetamol per day? Okay, put in the chat box. Okay, what is the maximum dose of codeine per day? How frequent will you give this medication? Well, I will not answer those. Just put it on the chat box so we have more conversation in the coming days. Go back to this video and share this video. We will now end our live today. I hope really enjoy it. Yeah, I hope you enjoy it. We will see again each other next week. Let's do it again at 8 o'clock. Again, put your comment below what topic you want to discuss. And of course, just to promote, we have another final coaching next week. Yeah, it's 14th, I think. One next not this weekend, next weekend. Yeah. Please, if you can enroll on the class. We will have some fun there. Um, purchase the workbook. The work will part of the final coaching, and join the channel. There you go. Have a nice evening, everybody. I hope you really enjoy it. Thank you for staying with me, and see you next week. Right? Have a good night. Good luck. If your exam is tomorrow, good luck. Okay, or this week, good luck. All right. Bye bye. Bye bye. Good night. Good night. Sleep now. Good night. Bye bye. There you go. Good night. Good night. Good night. Oh, you're a she. Sorry, Sonu. Okay. Good night, everybody. Bye bye. Bye bye. I'm sorry about that. Okay. Bye bye. Good night.